The development of this podcast was sponsored by Alexion Pharmaceuticals Incorporated. The viewpoints expressed are those of the person speaking and not of Alexion. Welcome to NMOSD Your Way Global, an educational podcast series for NMOSD patients worldwide. NMOSD stands for Neuromyelitis Optica Spectrum Disorder, a rare relapsing autoimmune disorder of the central nervous system which primarily affects the optic nerves and the spinal cord. Your podcast hosts Lalania Lloyd and Debbie Latique, who have both lived with NMOSD for over 10 years, will be bringing their respective Canadian and Australian perspectives to the table in order to help patients worldwide better understand NMOSD. Over the next 16 episodes, clinicians, researchers, and fellow patients will come together to have important conversations about how to live your best life within your diagnosis. They will be offering up encouragement and practical tips for overall health and well-being. In this episode, Debbie talks with psychologist Sally Shaw to share insights about how to navigate relationships when dealing with NMOSD. So, let's get started.
Sally, you're back.
Hey, Deb.
Great to have you back again. Living with NMOSD can put a lot of stress and strain on relationships, can't it? But it can also be difficult to explain to others what you are going through, as it can be quite a burden.
It's really hard to find the sweet spot, the right place to position yourself in terms of how much you want to communicate, to whom, and which messages you want to use. And I often work with people, Deb, who don't think about it from a strategic point of view, and that actually sounds a bit cold, doesn't it? But they don't step outside the situation and have a look about their communication and how they could do it well. And I think that's the first place to start with this. When we think about communicating with people that we love, we need to think about it's multifaceted. Lots of things shape that space. And I speak to lots of people that say, you know what, I was given the diagnosis. It took me a long time to process. We were talking last episode, Deb, about, or the last time I was here, about how hard it is to, it might take 12 months. It might take longer than 12 months to stop thinking about it all the time. But you might get to a point where 12 months down the track or 2 years down the track, you think, you know what, nobody else can fix this. I can't even fix this. So I don't want to talk about it anymore. I don't want to be a whinger. I don't want to tell people how I'm feeling because they can't fix it. I don't want to burden them with it, so I'm just going to say nothing. And a lot of people fall for this trap because they think that that's the right thing to do for the people they love so that they're not sharing the burden. The problem with that, Deb, as you know, is that it leaves us having relationships, long-term relationships that might not sit in a genuine kind of zone, because what we do is we end up hiding a lot of our experience from people that we love, and we think we're protecting them, but actually we're just building up walls. What we need to do is have a think about what is the best thing for the relationship, because as we discussed last time I saw you on the couch, we discussed the fact that it's important for them to have a little glimpse into our reality. It's important for us to nurture genuine relationships with people, and that includes that level of honesty. So while I don't encourage people with NMOSD to talk about it every minute of the day because their partners don't want to hear that, they don't want to hear it. People with NMOSD don't want to talk about their symptoms every day because we bore ourselves with our own details of chronic health concerns. So we need to find a nice middle point. And so my first, piece of advice, I guess, for anybody around communicating and connecting with the people they love is around having a conversation about the communication itself. So that sounds a bit out there, but actually having a conversation with, let's say, a partner about how should we do this? Like now one of us has NMO. And it might be, it might be me that's been diagnosed with this chronic health condition, but it's going to affect our relationship. How should we come together as a team and approach it? Do you want to know all the details? Do you want to know none of the details? And does that level fit comfortably with me? So an example from my own experience, if it's okay to share with you, Deb,
absolutely,
is that Thank you. I developed some pins and needles in my nose. It's part of having MS, and it's not a big deal, is it? Pins and needles in my nose, it wasn't stopping me from functioning, it wasn't stopping me from doing my job, it wasn't even bringing with it any fatigue. So it was just a little bit, that's annoying. And I think that our listeners will understand that when you feel something change, the uncertainty and the anxiety is linked to, where is this going? What's next? Because little pins and needles in your nose could lead to something else that could be bigger and bolder, and off you go for steroids. You know, who knows what's coming when you get pins and needles in your nose. But I also didn't want to talk about it because I didn't want to think that anything was happening. You know, I didn't want to acknowledge that anything was going wrong. So I was left with a difficult decision. Do I talk to my partner about this little symptom that means nothing, or do I keep it to myself? And I think at that point, I realised that actually he deserved to know, because the MS was in the relationship. He just wasn't privy to all of the information that unfortunately is in my body. So unless I share the invisible symptoms, he will have no knowledge of them. And imagine if I didn't share them with him and 2 weeks later we were at the hospital and the neurologist was saying, "When did this start, Sally?"
And would you also suggest, Sally, that it's you might have these family consultations as well, yes. Family meetings? I know I did with my kids when I was diagnosed with NMOSD, and it was a chance for us also to discuss moving forward and, you know, ways of helping and all that sort of stuff.
My personal take on it is, as young as they are, is a good place to start. So however old they are, with age-appropriate information. So I always think it's good for it to be organic if possible. So I know that I had my children after I was diagnosed with MS, but there came a time where I thought, they're old enough to take a bit of information that they might not otherwise know unless I tell them. So I started, to be honest, just bringing it into conversation, which seemed a bit uncomfortable at the time, but actually meant that now at the age of 12 and 10, they know I've got MS. It's not a big surprise. If something happens, they're not shocked by it. And I would hate for family members, particularly kids, to be shocked by something that the mother or the father knew was happening for years and years and years, but never really explained or involved them in. They might feel that they were left out of the secret, and we don't want that for families. We want people to feel like they're part of your team, because that's what ultimately is going to assist you as the person with the condition.
Looking back, I think it's really important to do that sort of thing. I also wonder, Sally, what do you think about sharing it with your work colleagues, for instance, because that's another form of communication with relationships in your life?
Such a good question, Deb. I think that's one of the hardest questions, because every person is different. Every relationship of that person with NMO is different, and every employer is different. So there is absolutely, for this question, there is no one answer. I love the idea of a workplace where everybody can be open and honest and nobody's discriminating and nobody gets fired, but it still is not the case for every employment situation. So I think it's important, really, I'm going to give you the boring answer and say it has to be assessed individually, case-by-case basis.
I know
it's a hard one, isn't it?
It is. Well, it wasn't hard for me because I was in a school setting, so the staff had to be aware of what was going on, and the students certainly became aware of it, because I'd be walking down a corridor and the next thing I'd be sitting in the corridors, because my legs would just go on me. And it was actually really good. The same thing about how much to tell children and at what age category. But in the end, if my voice became really weak, the kids just knew. If it became weaker and weaker until I couldn't speak anymore, they just grabbed the little treble clef, because I was a music teacher at the time, grabbed the little card on the wall, and they'd just take it up to the principal and just say, this is what's happening.
Yeah, Deb needs some help. Yeah.
So I think
fantastic.
Being open about it, I think it helps also kids be resilient about things that are different in their lives as well. So,
and I think on that point, if you are somebody who has decided to tell their employer, as you did, then tell them and give them gifts. And I mean gifts as in tell them how they can support you. Don't dump the news and then say, well, good luck supporting me with this. Dump the news and say, the ways that I think this might affect my work can be X, Y, and Z. Or even, I don't anticipate this will affect my work, but what I will do is endeavour to tell you if I see it being a problem, or I will let you know if I need some support, or I've been thinking about it and the only support that I need at the moment would be maybe the consideration of air conditioning in the room, or, you know, I don't know what it is, move my office to somewhere with fewer stairs, whatever it is for the person in question. But I really like the idea, if we're going to be open and honest with our employers, is to also take to them the strategies that can assist us, because then they feel not put on the spot and we won't feel maybe resentment if they try to support us in ways that actually isn't supportive at all. And I think employers can often fall for that trap. They try to give you a solution that actually you don't need, and then everybody feels like we're miscommunicating. So being really clear is a really good idea, of course, with any communication with anyone.
Mm-hmm. And in an ideal world, if you can communicate well, what happens if you've got a partner or a family member or a friend who just doesn't get it? What do you do? What do you suggest? Where can you go?
Yeah. I think the first thing that you need to do is to recognise that I've got a partner or a family member who's not getting it, and bring up that compassion again for yourself, but also compassion for people in your life. Because you know how we talked about identifying your coping strategies? Your coping strategies might be worlds apart from the coping strategies used by your family member. And while some family members can just be unsupportive and unhelpful, so I want to acknowledge that they do exist, sometimes we're wanting support from people. We want them to elicit the coping strategies that will help us, when actually that's not the coping strategies that they would naturally gravitate towards. So that might all sound like a whole lot of messy words, but let me give you an example. Often people are diagnosed with something like NMO and they say, great, I'm going to go to that conference that Deb organised or that Deb's involved in, that Deb's talking about. We'll go to the conference, or we'll seek the information and we'll get to meet everybody else in the world with NMO, and we'll be able to hear their stories, and that will be great because we'll get all that information and all that connection, and this will be fantastic. And the partner is sitting there going, what are we doing? I don't want to do that. I don't want to meet other people with NMO. That's not what I like. I've heard from multiple partners that have said to me, I will support my partner facing this challenge in whatever they need in the future, but I don't need to know what that person's facing, and I don't need to know what that person's facing, because that's nothing to do with me. And for them, it's really damaging or confronting or difficult to engage in a coping strategy that you might find to be the best coping strategy in the world. So I think that's where I'd start, some kind of trying to say, look, they're probably trying their hardest, but they're getting it wrong. And then I think the next spot is to talk about the topic more broadly. Talk about, you know, if we're in this together, how are we going to manage it? If we apply a team approach, how should we manage the roles here? And can I do something to help you through this? Do you need something that I'm unaware of? Do you need a particular type of support from me or from someone else that I can help you with that I haven't thought about? So maybe turning the support back on them a little to see if there's something they need. What do you think, Deb? Do you think that's...
I think that's really good advice. For me, at the time, when you're living through it yourself, you actually... all the focus at the time is really on your own body and the strangeness. But if you can manage to do that, I think that's a terrific idea as well. I certainly found it difficult to share the invisibility of the symptoms, so with my family and friends. So I ended up making a video when I was having a relapse. It was very confronting. In fact, it was even confronting for me when I watched it back, and I said, oh my goodness, I don't know if I want to share this. But I'm so glad I did, Sally, because all of a sudden, you know, my mum and my sister and my friends are saying, oh my goodness, I had no idea that this is what happens during a relapse. And their compassion and their care for me shone through afterwards. So
wonderful, because their empathy could grow given they had more evidence, they had more information. They needed to see it for themselves. I think it's an interesting point, the invisibility of the symptoms and the changeability of the symptoms. They come and go sometimes, not everybody in our life can see them, but also our partners in particular, or our family members who want to fix things. So I don't know if you've had experience, Deb, or if you know of others who have had experience where somebody with a chronic health condition can say, oh, I'm just so tired today. And the partner jumps in and says, well, you should have a nap. And if you don't want to have a nap, or if you know that actually a nap is not going to fix the fatigue that you've got, it's a clear message from your partner, even if they don't intend to send it, is a clear message that says, if you don't have a nap, you cannot complain. And it shuts us down. It shuts us down. So often I suggest to people that they talk to their family members about what to do to support you. So educating our family members that when I tell you that I'm so tired, I know that sometimes I might say it quite a bit, and I'm sorry because that can be difficult and uncomfortable for you because I know you dearly love to fix this for me. But when I say I'm really tired, instead of telling me how to fix it and instead of telling me to take a nap, maybe you could say, that sounds really hard. Because as ridiculous as that sounds coming out of my mouth, there is so much joy to be had when a partner says to somebody, oh, that sounds hard, with a snuggle, enter hug. That sounds hard. Hug, full stop. Don't try to fix it. Don't offer me a solution. Just acknowledge that I'm having a hard time, and then I will feel heard, and then we move on, in an ideal world. So often that's the next step too, to help encourage the people around us to support us in a way that we're going to feel validated and heard and cared for and supported, but not judged and not told what to do.
Yeah. For some people living with NMOSD, their partners end up being their carers. That can be enormously challenging. What advice can you give to people to work through that huge adjustment?
Yeah, it's a huge adjustment. Huge. So in order to not make it as huge, in an ideal world, we are having those conversations before the role of carer even comes into play. Now, I know that's not always possible. It might be upon diagnosis of NMOSD that then there needs to be a carer around. But sometimes it can be up and down. Sometimes it can be something that happens in the future, if at all. So I think conversations early on about how would we manage this? If my levels and need for support and care increase, do we think as a couple that you should be the person providing that care? And are there boundaries? And really maybe where are the boundaries? Does it include that my partner, the love of my life, my husband, my sexual partner, did they become the person that showers me? Or are we going to have boundaries around that? Now, these are really uncomfortable conversations, aren't they, Deb? Like particularly early on, because everybody's hoping that never happens, that you never need a carer in that role. So we have to be cognizant, of course, of the fact that when we're ready to have that conversation, if we are ever ready, before it happens, that the person we're having the conversation with, are they ready? But sometimes we can foster those conversations early on, start planting those seeds about looking at these things strategically so that the emotion, it doesn't play into it as much if we look at it strategically and early. And then by the time we need, if we ever need, a little bit of increased support, we've already got a bit of a plan. Oh, remember we thought that if, we were to get to a point where I needed some support around these personal hygiene matters, whatever, we were actually going to get somebody in to provide that so that you can remain my partner, my lover, etc.
That's exactly what I was just going to say. With the resources that we have at hand today, you can still remain a partner and have plenty of care outside the home, can't you?
That's right. But sometimes it's hard and we become passive, understandably, in a very complicated world, and we get swept up in doing what is necessary. And sometimes having our partner be our carer is necessary, so they slip into the role, we accept it, and off we go for the next 20 years. But actually, with a little bit of strategizing, we can create a better picture for us and our partners. And the relationship, remember we talk about what's best for the relationship. We really need to honour and value the relationship, or it won't survive often.
Being the person with a chronic illness can put terrible pressure on socialising as well. But we know that maintaining strong connections is very important isn't it? How do you get the balance right yourself? Do you have any tips?
Yeah.
I know you're good with the tips.
Yep, love the tips, Deb. Love all the tips. It's super important. Do you know there are studies, there are quite a few studies actually, that look at relationships, friend relationships in Australia and how we navigate that through our life. And if you look at the good old Aussie male, there are so many studies that say men in their late teens, early 20s have stacks of friends. You know, they belong to the cricket club, the footy club, they've got friends from school, they've got heaps of friends in their part-time jobs, whatever, and they're out and they're socialising. By the age of 40, most Australian men can barely name 2 or 3 solid, genuine friendships. You know, men that they are communicating with, not just at birthdays, even that, but they're just in solid communication with. Weekly catch-ups or monthly catch-ups, texts, emails. It's really interesting. And women are not far behind. Our friendship circles reduce as well. We're a little bit better at maintaining and making new friends and maybe realising the importance of sitting down with our friends and having a chat about everything. But it's really important to step back again and say, what do I have control over? And we need to, at every age and stage, take personal responsibility for maintaining really good friendships and maintaining friendships with people that are good for us. To your point in another episode, looking at the people who love us as well as the people we love, making sure we know the distinction between the two, and the people that are genuinely wanting to care for us and are interested in our well-being, and nurturing the hell out of those relationships is really, really important. I think that somebody did ask me the other day about what I do for self-care. Somebody asking the psychologist, it was like, what? You're not meant to be asking me the questions? And they said, Sally, can I ask you what you do? How do you prioritise self-care? And I thought, okay, well, good question. Should always reflect, shouldn't we, if we're telling other people how to live? And, you know, I love a couple of things that I have as staples in my life, which is walking the dog when I can, getting my hands into the dirt, gardening. I'm not great at it. I do have chickens. They're like a little world of mindfulness in their little clucking and caring for them, as well as a dog and a family. So, you know, lots of opportunities to get dirty, and it's good to be out there in the garden and connecting. But one of the things that has struck me through these times of COVID is the importance for me in my self-care about connecting with other women. Good long-term female friends is at the top of my list of self-care, and me prioritising what's important for me to keep my bucket full, you know, whatever analogy you want to use, that's at the top. So knowing that it's important to you is the first step, and then being able to prioritise it. We have to work at it and we have to own it.
And we mentioned in the last episode too, it's really about cleaning up your life, and also finding the opportunity to have other interests and make new friendships. It's not about always, those old friendships that you've had for a long time are the salt of the earth. But for me, it was an opportunity to also, you know, start my own four-wheel drive and camping club. And, you know, I've got 150 people in it, and some fantastic friendships that have been made. I'm more social now with NMO than I've ever been.
Yep. Yeah, it's wonderful. And you've raised a great point, Deb, because we have to always, I'm really encouraging people always to continue to be interested in their evolution. We are not necessarily designed to have exactly the same friends that we had in Year 12 for the rest of our lives. And some people really struggle with that reduction in socialising that comes with managing a chronic health condition. And everybody's, not my friends, but everybody's out clubbing every night and I can't do that anymore. Could be a statement that somebody says, I'm not anymore. But, you know, that kind of late night partying, and if you are not in that group, you won't connect with them at all. You know, sometimes that's what happens. So we do have to acknowledge that there's grief around that, a grief around changing social circumstances. There could be a way, just like going to your employer with the solution, you can go to a couple of friends and say, I know that I can't catch up at the nightclubs anymore. That's even funny saying it, at the nightclubs anymore, but I would still really dearly love to see you and have conversations. Is there a way we could do once a quarter or twice a year or once a month, whatever works for you, brunch Can we do a brunch occasionally? So recognizing that, of course, not everybody else's life has to stop and everybody goes from the nightclub to the brunch. You're not expecting that because everybody has a life to lead and they need to be able to still go to nightclubs with their friends. But it's okay for you to try out some of that assertiveness and say, could we add something to the calendar and could it be a brunch? And you know what? You might lose a few people along the way and that's okay. That's okay. We need to show that compassion to ourselves and to them and form and evolve, form new friendships, evolve in different ways and continue on.
Some really good advice there. Thanks, Sally. An NMOSD diagnosis can mean needing to change the way you work and care for your family or, do your bit around the house. And this can put a lot of emotional strain on someone who is already very unwell. How can they approach some of those tough conversations?
Yeah, they are tough conversations. And primarily they're tough, I think, for people with NMOSD because we all want to be the same person that we think we want to be the same person that we were pre-diagnosis. We want to be achieving at the same levels. We want to be producing the same outcomes. We want to be actively engaged in everything just like we were before, and often our bodies are letting us down. Or often we are showing such high levels of self-compassion, we're no longer expecting ourselves to do as much as we did before. I would love it if that was the case. But often we're falling for the trap of trying to do everything that we used to be able to and not being able to. So you're right. There are difficult conversations to be had. If we can go back to what we were talking about before, it's about trying to elicit that team approach. How are we going to manage this now that we have NMOSD in our relationship? How are we, as two or more individuals in this household, going to deal with it? Are we going to share the responsibilities out a little bit? Are we going to take a very flexible approach? Are we going to check in with the person that has NMOSD in their body and say, what do you reckon you're up for this week? Are you on duties of vacuuming and washing the dishes, or are you on the online ordering of the shopping to be delivered? How can we divide and conquer in a way that suits everybody in the team, but recognizing that NMOSD is something. It's something now and it needs to be talked about and considered. But hard conversations, Deb. I mean, it's really hard to come up with a strategy that's going to fit everybody. But I guess another thread to that is to encourage anybody listening today, particularly if they're the person with NMOSD in their body, to be an active listener as well. We would always encourage our partners and the people in our life to be an active listener, to hear us when we tell them about our experience and to concentrate on the listening rather than the fixing, because they can't, but it frustrates them to no end. So they keep trying to tell us how to fix it.
I expect for many of our listeners who have NMO, or, if you know someone who does, that your confidence can take a bit of a hit. Oh my goodness, I can look back and think very clearly how low I became. Surely that has an impact on a person. How can confidence be rebuilt?
Yeah, it's massive. You're rebuilding an identity, and you're rebuilding an identity that you don't want. You don't want to make room for this in your life. So it's kind of, for most people, it's kicking and screaming. And your confidence takes such a hit because you're unaware of this body. Like, who is this? Who is this person that I'm now walking around in? And how do I navigate it? And can I negotiate? Often, Deb, I'm sure you understand this, that sense of, as human beings, we can all face challenges, and you hope that you have the confidence as you grow up and you're given those skills and the tools that you show me a challenge and I will be able to meet that challenge. Wouldn't it be great if we all grew up with that sense of self-confidence? And many of us do, which is great. Throw me a challenge, I can do it. When you were diagnosed with something like NMO, it's like the goalposts are moved. So you thought you were kicking that direction, and then all of a sudden the goalposts are over there. And it takes a while to figure out, I'm not kicking that way. How do I figure out how to kick in this direction? Well, the sun's changed. All right, well, now I'm going to kick that direction. But often with something like NMO, the goalposts are just taken away. And you're just standing on the field, looking around going, but what? I don't know where to kick. I don't know what I'm aiming for, and I don't know when the goalposts are going to land back down and where they're going to land and when they'll be taken away again. So we're right back to our earlier conversation the last time I was with you, Deb, about uncertainty. How do you build confidence in the face of uncertainty? And I think the answer, the answer lies in knowing who you are. Deep, deep, deep. Not your role, not your various life roles, not your position description, not a label that somebody else has given you, but who are you deep within? This sense of self is what gets us through, because a crisis shatters the illusion of who we thought we were, and we need to know who we are in order to face the challenges that will come in life. We know that life is not just going to be challenged by NMO. Unfortunately, this is not the end of it. There will be other challenges that come up. It might be financial problems. It might be relationship problems. It might be health concerns of somebody that you love. There will be more. It's not just this. So we need to have a very firm idea of who we are moving forward. And that can be done in a variety of ways.
And is it also about having a purpose in life too? Because often some people feel that they've lost everything and that they have no goal or no purpose. And without a purpose, what have they got?
Yes. So there is a fantastic, relatively simple way of examining that. What is my purpose? It's you never wish this type of diagnosis on anybody, but boy, it does give you pause for thought, doesn't it, Deb?
Absolutely.
And sometimes if you use that pause for good and not evil, you can resist going down the spiral or the catastrophic thinking that could lead to, in some instances, depression. And you can instead, and I know it's not as simple as I'm making it sound, but you can instead say, right, I'm actually going to have a good hard look at what's going on here. I can step outside of myself for a sec and say, what is the purpose? Where do I find meaning? It is very clearly not about who you see yourself to be, but rather why you are here and what you engage in that brings meaning to your life. So it's not about being a teacher, but it's about educating others. It's not about necessarily loving family members, but it's about having them feel your love. And it's a very good way to remind yourself that you are more than a diagnosis label. You are more than a role in life, like mother or wife or teacher. You have a bigger sense of purpose than that.
And finally, what advice would you give to someone who is supporting a person living with NMOSD?
I think the best advice to give to anybody supporting anybody is to be interested and to be kind. I actually think that's just a really great way to live. Generally speaking, with anyone, be interested in the person next to you and their experience. Don't presume you know, because we will never know what the person next to us is going through, but we can be super interested. So be interested about how they phrase it. Ask them for their words around what they're going through. Be kind, be patient, expect the same back, which I think is a good one, because we need to be kind and patient to the people that are supporting us, and interested in their experience as well. Empower the people who have been diagnosed with such a condition. We want to be able to help people lean in to having NMOSD, because we want people to manage this condition in an optimistically realistic way. I don't want to say in a positive way, but it's all about being optimistic but realistic. And so empower them to do that. Empower people in your life living with conditions like this to talk truthfully about how they are going, and to be able to express their feelings to you without you trying to fix it, without you trying to shut down that expression of emotion. Because sometimes we just need to be sad. Sometimes we just need to be angry. Sometimes we need to acknowledge that we're having a bad day in order to have a good day the next day. So it's really important to be interested in that experience and to let the person with the chronic health condition have their experience.
Fantastic, Sally. That's a lot of really useful advice right there for anyone who is either living with or caring for someone with NMOSD. Thank you again, Sally, for sharing your wisdom on the couch with me. Stay safe and well until we catch up again. Thanks so much.
Thanks, Deb. Thanks for having me.
We hope you have enjoyed listening to this NMOSD Your Way Global podcast. For more information about NMOSD and access to support and resources, please read the podcast description. What you have heard in this podcast may not be reflective of your own experience and does not replace the advice of a healthcare professional. If you have any concerns or specific questions about NMOSD, please speak to your physician.